Foods high in high-fructose corn syrup deserve particularly strong caution for anyone with gout, elevated uric acid, insulin resistance, or metabolic syndrome, because their impact goes far beyond simple, empty calories. High-fructose corn syrup delivers fructose in a concentrated, rapidly absorbable form that bypasses normal glucose regulation and is metabolized primarily in the liver. This process directly accelerates purine degradation and increases uric acid production, meaning these foods do not just correlate with gout risk, but actively drive the biochemical pathway that raises blood urate. Large population studies consistently show that people who consume more HFCS-sweetened foods and drinks have significantly higher rates of gout, more frequent flares, and poorer uric acid control, even when total calorie intake is similar to those who avoid them. A major problem is how hidden and pervasive HFCS has become. It is commonly found in processed snacks, baked goods, candy, breakfast cereals, flavored yogurts, sauces, salad dressings, condiments, and many foods marketed as convenient or even healthy. This makes chronic exposure easy and often unintentional, leading to repeated daily fructose spikes rather than occasional indulgence. Unlike whole fruit, which contains fiber, water, and phytonutrients that slow absorption and blunt metabolic stress, HFCS delivers fructose rapidly and in isolation. This overwhelms the liver, promotes fat synthesis, worsens insulin resistance, and reduces the kidney's ability to excrete uric acid, creating a compounding effect that is particularly damaging for people already prone to gout. Beyond uric acid, these foods worsen systemic inflammation and dehydration risk, both of which increase the likelihood of gout attacks. High-fructose corn syrup increases oxidative stress and inflammatory signaling, priming joints for flare-ups when uric acid crystals are present. At the same time, HFCS-rich foods often displace more hydrating, nutrient-dense options, contributing to subtle chronic dehydration, a well-known trigger for gout. They also promote weight gain, especially visceral fat accumulation, which further impairs uric acid clearance and increases flare frequency. For people on urate-lowering medications, high fructose intake may blunt treatment effectiveness, making blood urate harder to control despite adherence to medication. Nutritionally, these foods offer little protection against these risks. They are typically energy-dense and micronutrient-poor, providing calories without fiber, meaningful vitamins, or minerals. Even when fortified, the metabolic damage from repeated fructose exposure outweighs any marginal nutrient benefit. Over time, regular consumption contributes to fatty liver disease, dyslipidemia, and cardiovascular risk, conditions that frequently coexist with gout and worsen its long-term outcomes. For gout-prone individuals, reducing HFCS intake should be considered a core management strategy, not a minor dietary tweak. This requires careful label reading and skepticism toward processed foods, especially those that taste sweet but are not obviously desserts. Replacing these foods with whole, minimally processed options, vegetables, whole grains, legumes, plain dairy, nuts, and modest portions of whole fruit dramatically lowers fructose load while improving hydration, satiety, and overall metabolic health. Even whole fruits high in fructose should be eaten in moderation during active gout or frequent flares, but they remain far safer than HFCS-containing products. In practical terms, frequent consumption of foods high in high-fructose corn syrup is one of the most avoidable and damaging dietary habits for gout and uric acid control. Unlike some purine-rich foods that may be tolerated in small, infrequent portions, HFCS creates repeated metabolic stress with no meaningful nutritional upside. Treating these products as routine foods significantly increases the risk of flares, undermines medication effectiveness, and worsens long-term joint and kidney health, making strict limitation or avoidance a prudent and protective choice for anyone concerned about gout.